I love the topic of oral contraceptives because it's almost a hallmark of female empowerment, so I want to give it respect where it's due. It was a large part of the women's health and we own our bodies movement. So that took us so far, and now I almost view, when I'm talking about oral contraceptives, I want to give it that respect, but then I want to take it to the next level. So let's just continue what those women fought for us. And really the next stage is learning how they impact us, and then what our own body is capable of with its own reproductive cycle, which is why oral contraceptives are not my favorite. If you need them, they have their purpose. They do have their purpose, so I'm not saying there's not any need for them, but I think they might be overprescribed, and then we might undereducate patients on the true effects of them, and then the true alternatives, like what else can we do for contraception. Essentially, you're giving your body a synthetic estrogen and then a synthetic progestin. And I use the word progestin because patients and even providers will say progestin as if it's progesterone, and they'll talk about it as if it's a progesterone. But a progestin is actually a synthetic analog similar to progesterone, but it actually can have estrogenic effects, so it can act like estrogen, which progesterone does not do that. Progesterone acts like progesterone. And they can act like testosterone, or they can act like anti-testosterone. So whenever you're taking, or a hormonal contraceptive is prescribed for skin, it's because the progestin has anti-androgen effects. So that's just, you get into a lot of messiness when you start having one of the hormones be able to do 3 different hormonal things, and the other one's a synthetic analog. And essentially you are shutting your brain and your ovary down. So your brain is gonna stop telling your ovary to make its own hormones. So I think about it like exercise. You have muscle memory. If you shut your ovary down for 10, 15 years, when you want it to turn back on to get pregnant, it's gonna be rusty. It's not gonna have the memory of that cycle. So I worry for patients for that, just really fully knowing you might have problems with fertility at first because that ovary is rusty. And then you lose all that time learning about your own cycle. Like you really are just shutting it down, and then you have no idea how you are on your follicular phase, and then the changes that happen at ovulation, and then what happens in your luteal phase. And that's part of your power as a female. So we need to have contraception when we need it, but then we also need to understand our cycle.